The CDC Foundation helps CDC do more, faster. In no event is this role more important than in a public health emergency. As Hurricane Katrina roared toward the Gulf Coast in August 2005, we quickly realized that an emergency was on the way, and we stood ready to support CDC's response.
Following Hurricane Katrina, the public health community was seriously concerned about the increased risks to health and safety threatening residents and response workers in flooded communities and crowded shelters. CDC immediately deployed response teams to help protect people on the Gulf Coast from diseases, injuries, chemical exposure, and environmental hazards. To support these response teams, CDC Director Dr. Julie Gerberding asked the CDC Foundation to activate its Emergency Preparedness and Response Fund. Activating the fund allowed CDC responders to use special emergency credit cards to purchase whatever they needed to get the job done, from wireless internet cards to giant banners that promoted hand washing in shelters. Dr. Gerberding also asked the CDC Foundation to expand the scope of the fund to provide resources directly to state and local public health agencies in the Gulf Coast.
Communities rely on their state and local public health agencies for an extensive array of services, from immunizations to disease and environmental surveillance. In the aftermath of Katrina, teams from those agencies were among the first responders on the scene. We knew that getting these agencies what they needed quickly was critical to protecting the health and safety of those affected by the hurricane. Hundreds of individuals and several organizations also understood the vital importance of supporting state and local public health agencies and made generous donations to the fund. Key among them, Kaiser Permanente made a lead gift of $2 million, and the Robert Wood Johnson Foundation contributed $1 million.
One of the things we knew from some work in previous disaster situations was that the public health infrastructure is the kind of thing that often gets forgotten. Immediately after something happens like this, you start to worry about disease, you start to worry about poor people who depend on county health departments and community clinics for care. And we were hearing reports that lots of those had literally been washed away and didn't exist anymore.
The gifts to our emergency fund enabled us to help state and local health agencies purchase everything from prescription medication for evacuees to laptop computers for response workers.
Following Katrina, there were enormous gaps in the infrastructure and in the services available to the citizens remaining and to the professionals in Louisiana. The federal government was stepping in to help. There were serious needs that were unmet. We called on the CDC Foundation, and they immediately responded with resources that would enable those gaps to be filled, enable a public health system to be maintained, and to ensure that the citizens receive the services they need in mental health, in public health education, in communications and outreach that I'm sure saved lives.
One of the most urgent requests for help came from the Mississippi Department of Health. When Katrina passed over Hancock and Jackson counties on Mississippi's Gulf Coast, 2 health department buildings were completely destroyed.
When we came back to Hancock County after the storm, our first thing, of course, we went to our home, and we had found that there had been 7.5 feet of water in our home, and everything that we owned, everything that we had was gone. So we decided we would check on the health department, and we went by the health department and found it also had been underwater, and the ceiling tile had came down. The mud was also everywhere. It was just, it's just indescribable how your whole life all of a sudden is turned upside down.
The CDC Foundation helped the Mississippi Department of Health acquire 2 specially designed modular public health clinics to replace the 2 facilities. GE manufactures these modular clinics and generously agreed to donate the facility for Hancock County.
When we first came back, I returned. I went to my parents in Vicksburg. So when I returned back to the coast, the health department was working out of a little blue pop-up tent in the Kmart parking lot. So that was exciting just to see. I consider us all family, so it was exciting to see us all together again. And at that point it didn't matter, but then that soon wore off when the temperature started dropping and the bugs were eating us alive. And and we moved into our little Quonset hut. And we were excited about that because it was a little bit more stable. It could handle the wind a little better.
We heard that the GE Modular, through the CDC Foundation, was going to provide us a modular unit, and the whole staff was so excited. When we would hear a truck go by, we would run to the Quonset hut and look out just to see, was that it? We were so excited.
I watched every day for the trailers because that was one thing that, that moved us ahead to get us back to some type of normalcy. And so when they first came in, I wouldn't yell at everybody and our home's here, our trailers are coming, and so they were excited. I guess I got everybody else pumped up because, it was something bigger than where we were living and something just a whole lot better than where we were. And this is actually bigger and better than our old building. So, we've moved up. The storm had its downfalls, but it picked us up a whole lot too. We've bonded, we've learned patience, we've endured, and we're still dealing, and that's given us strength. And and we get to rebuild our lives right here in this building and plan for the next step, the bigger step.
There is much work yet to be done, and it will take many years to rebuild our Gulf Coast communities. But progress has been made thanks to the combined efforts of the government, corporate, and nonprofit sectors, and the immeasurable dedication of public health professionals, from CDC leaders in Atlanta to nurses and social workers in Hancock County, Mississippi. Thank you, all of you, for being a part of this important response effort.